Again, greetings, good evening. Thanks for joining tonight. We're happy to sponsor this town hall for the MS3 group that have been active, I know, on the remote portions of your clerkships, and we're eager to talk with you about what's coming next. Delighted to have our entire medical education team here today, who you'll hear from in a few moments. Just a couple of framing comments before we get started. I'm going to invite Dean Martin, who's here, to see if she'd like to offer a welcome. Largely, we're going to address, mostly as we have in prior town halls, questions that have come in ahead of time, particularly those questions that informed the FAQ message that went out from Drs. Miller and Napolitano earlier this week. We'll have an opportunity for you to ask some questions, and then we'll be joined at the second half of this town hall for a little unique feature where we've invited some of our more advanced trainees, some house staff, particularly some residents, some chief residents, and some MS4s who will reflect on their experience on the wards in ways we hope will be instructive and informative for you as you contemplate what's coming next. The session is being recorded so that individuals who come in late or who weren't able to join will be able to review this at a later time. I'm going to pause to briefly invite Dean Kelsey Martin if she wants to say a brief greeting. Dr. Martin?
Yeah, thank you, Dr. Braddock. No, I'd like to thank you for being at this town hall. I want to thank everybody, all the panelists, for participating. I mean, this is a pretty exciting time when you're about to go onto the clinical wards, the next part of your training. And I certainly recognize that it's always a time of anxiety, and this year it brings a lot of uncertainties that haven't been there in the past. And so I think that it's, thank you for submitting your questions. I want to again thank the whole education team for hosting this and many other town halls. I hope that you know how dedicated everybody is to doing everything we can to make sure that there's great communication to you, that your questions are answered, and that we all help you and ourselves navigate through this real time of uncertainty. And so with that, I'm going to turn it back over to the team.
Thanks so much, Dr. Martin. Really appreciate your being here and for your words. I would just add to that as we go on, and certainly couldn't agree more with the dean about this is kind of one level a moment we've all been waiting for. Obviously, you've been in med school for a bit, but the opportunity to really begin this part of your training, this pivotal and formative part of your journey to become a physician, being able to be actively involved in the real care of real patients. We know that that's different now because of the events that really have been going on since earlier this year, and are very grateful to the efforts of our team for the huge amount of work that it took to create the remote versions of the clerkships, and the incredibly creative work of our clerkship chairs and our team in curricular affairs, and the important planning and conversation not just within the school but with officials both on the campus and in Los Angeles County to make sure we're moving forward in a responsible way. So yeah, this the pivot from being a pre-clerkship student to a clerkship student, I think we all remember that time as a time of great excitement and great apprehension, but we also recognize that this is a particularly unique version of that you're all experiencing. So we hope that tonight does help to kind of frame that transition for you in ways that are helpful. So I'm going to turn things next over to our two co-MCs for the evening. I'll introduce first Dr. Jason Napolitano, who needs no introduction, but I would like to take the opportunity to publicly welcome him again as our new Associate Dean for Curricular Affairs. He's 24 days into the job, but is already operating like a true veteran in that role, and so very grateful for his leadership on a number of fronts. But I'll turn things over to Dr. Napolitano and then to Dr. Lee Miller.
All right. Well, thank you for your wise words, Drs. Braddock and Martin. Important to sort of have perspective as all of you face, this next step. As mentioned, there's, usually quite a lot of questions heading into the wards and the clinics and beginning third year. Add on top of that, a pandemic and a major change in the grading system. And, it's no wonder that there's a lot of questions out there, and hence the the reason for being here tonight. I will let you all know that you're going to find people that are excited to have you in the clinical space and are prepared for you. You'll find a flexible team that really wants you to learn, wants you to be immersed in patient care. And I think that once you kind of, get the first couple days underway, you're going to feel, really good about where you are. Agenda-wise, as Dr. Braddock mentioned, we'll probably open up for Q&A after a couple minutes of words from Dr. Miller, maybe Dr. Ha. Really want to get to your questions, and also want to save at least a good 25 minutes at the end. You'll probably have a lot of, policy-related questions for the deans and directors here, but the last half of the hour, really the people that have been there taking care of patients day in and day out can answer some practical questions about what your days are going to look like. So welcome, and glad you're all here. I think I'll turn it over to Dr. Miller for some introductory remarks and anything that you want to sort of kick us off with as far as maybe questions you've been hearing quite frequently.
Yeah, just a few, just a quickie comment, because we want to save as much time as we can for the questions. And as we all know, these have been such challenging times in both the world and our country, and there's so many stresses in our lives. And for you folks, navigating the first days in the clinical setting as a third-year student is just one of them. And all of us can very clearly remember our first day on the wards and how we felt, our first patient encounter. I have some good stories, and I can tell you about that later. And while it's stressful, and it's stressful for everyone on that first day, we share your excitement for this experience, and this will be an unbelievable learning curve year for you. At the same time, we want to provide as much support as possible, and there are lots of ways to do that. We need to maintain open lines of communication. We're available to you for individual support. And as Jason mentioned, we're bringing to this session some more experienced students, residents, and chief residents to answer your questions and share their recent experiences. For those of you, we don't want any of you to feel pressured that you have to begin your first clinical rotation if you don't want. And there are some individuals have very unique circumstances, and we welcome the opportunity to think out loud together about those, and we'll respect whatever decision folks would like to make. We feel it's so important, though, that you understand your options, make a well-informed decision, and that we answer as many questions as we can as you start this incredible year. So I'll pass the baton to Ed Ha to see if he wants to say anything, and then let's hit the questions.
Thanks so much, Lee. No, I don't have much to add. I think, again, really excited that we're able to get to this point where things at our clinical sites are now stable, even if the case burden is increasing locally and across the nation, that our clinical sites are stable such that we can bring you all into the clinical realm and start having you continue to cultivate those key clinical skills that will ensure that you will all be confident and competent in taking care of patients as you enter the fourth year and certainly planning for residency as well. So obviously a lot of excitement on our end. It'll be great to see all of you sort of back on wards as well. I go on service this weekend, and so I'm hoping to see some of you around the hospital next week. But yeah.
All right, perfect. Without further ado, anyone that has a question, just click on the participants tab and raise the little blue hand, and Ashley Seymour is kind enough to sort of manage the hands up and call on you and unmute you for your questions. All right, shortest town hall ever. Everybody have a great night.
Well, I have something that I've heard that I've gotten a bunch of questions on, and it's related to the MSPE with you folks being in a no credit year, so I can just take a second to address the questions that have come in while you folks may be thinking of other questions. This has come up, of course, for the current fourth year class, and we're in the throes of MSPE season, meeting with every senior student our team is meeting with every senior student on an individual basis to help guide folks as they launch into the residency selection process. For the current fourth year class, there's a mix of some students will have 5 4-tiered grades, and some will have 8, and some will have an incomplete, and some will be no credit. And there's no way to be able to create any kind of final graph or ranking. And that's the most common question I've gotten, or one of the most common questions I've gotten is, are we going to be ranked? And we actually never ranked students. And that's a long backstory, but there was a summary graph that showed the distribution of grades comparing students in the class, but there was not a formal ranking. But there's no way that will be able to exist in a credit, no credit grading system.
And then just to make a brief comment on another question that's come up quite frequently, it's about AOA ranking. Just want to sort of make it clear that AOA is run by students with a specific faculty advisor, not by the dean's office. So, questions can be directed to the student leaders in AOA about, thoughts on, the process going forward. Dr. Lehman, you had a frequent question that was coming your way about the scores that are generated by the shelf.
Yeah, so I did have some questions from my clerkship students from pediatrics, and also just from my society students, wondering about the shelf exam score. I think everyone knows that it's going to be pass-fail per our change, but the question was about that score. When they get a score, will that be anywhere? Will that be in the MSPE? Will that be in anywhere in their record that goes to the residency programs? Do you want me to answer that, or do you want to?
Please, yeah.
Oh, yeah. So this is really truly going to be pass-fail. And so the record of your score will not be included in your MSPE. It'll just that you passing the shelf is going to be required to pass the clerkship, but passing will be at the 10th percentile as it has been, but there's no score reported anywhere. So I hope that answers questions that some of you may still have.
Great. Any questions or concerns from the audience?
Maybe, Jason, since we have some of the senior students and residents and chiefs here, we can also use time to ask them questions or have them speak, and then that will give folks more time to maybe think of other things to ask us if we don't get more questions.
And we do have, I think, one hand up. I had seen Russian's hand up a moment ago. Maybe it's back down now.
There it is. Okay. Russian, I'm going to unmute you so you can ask your question. Go ahead.
Awesome. Are you all able to hear me?
Yes.
Perfect. Hi, y'all. I know that this has come up in a lot of conversations. Is there just a way that y'all can maybe give a brief outline of what actually shows up in the MSPE? I think knowing just like a little bit of what that would look like, I think helps people mentally map sort of going into clinical rotations.
Yeah, I'll take a start there, and then Dr. Miller, you can comment because we've worked on this together. I mean, actually, there's it's a standard letter set of guidelines. You can actually Google it and find the the general framework for it online if you're interested. But it includes sort of a section on unique characteristics of the student that you work on with your assistant dean and with Dr. Miller. There's parts of that, basically a little summary of your narrative comments from your clerkships. There's a part that talks about special things you've accomplished, but it's a letter that largely is put together by Dr. Miller and the assistant deans, and the student. As a student, you do have some input into a portion of it, but it follows a pretty standard format. And those, if you're interested, you can look for that. And it's there's like a monograph on the MSPE. It's called the Medical Student Performance Evaluation, or MSPE, aka Dean's Letter. But Dr. Miller can maybe give a more detailed answer.
Yeah, that was a good overview. It's there are many components to it, and the part that there's a team of 6 folks that work very hard on it. Each of the 4 assistant deans plus Dr. Kalmus and myself work on the noteworthy characteristics section, and these are really some of the most fun meetings that I have now, because it gives me an hour to connect with every student and just talk about their interests and help plan out their year, and we work together on their noteworthy characteristics. And I know that Dr. Kalmus and the Society Deans have really enjoyed the opportunity to do this as well. They do the first meeting, and then I meet with everyone, and Dr. Kalmus meets with the Drew students, and I meet with many of them as well. And then there's a standard template, and there's a line about the pre-clerkship curriculum that is a section, but it's one sentence that students successfully completed the pre-clerkship curriculum. There's a section on professionalism, and there's a really nice insert that we have there talking about it's a template thing. It's used for everyone that describes the important elements of professionalism that students demonstrate over the years. And then frankly, the body of the letter is the summative comments that are submitted from students' clerkships. Now, the letter will change because now, in addition to the summative comments, the MSPEs now will have a histogram for each clerkship. So each of the 8 clerkships in which students received grades in the 4-tiered grading system will have a distribution of what percentage of students in the graduating class earned honors, high pass, or pass, with an arrow over the histogram bar that reflects each student's grade from that clerkship. And then below that chart, there's a summative paragraph that is exported. It's from the evaluations that you guys will be receiving in the credit, no credit grading system. For you folks, there's not going to be any graph because there won't be any grades, but there will still be the content. There will still be the exact wording, actually, of the summative evaluation from each clerkship. At the very end of those 8 clerkships, and there's a little insert and feedback from longitudinal preceptorship and from systems-based healthcare. Then it moves on to describing your performance on 4th-year electives. And any electives that you complete before the MSPE preparation deadline will also have the summative sections included. And then in the current MSPE template, there's a histogram which describes how students have done in the grading system, but that won't exist for you folks. Now, we need to redo the whole template based upon changes in the grading system, based upon COVID-impacted rotations mostly for the current 4th-year class, and new guidelines that there are new COVID-19 MSPE Dean's Letter guidelines from the AAMC that just came out last week. And then, so once we master that template for the current senior class, then we'll move on to yours for the next year. But I hope that gives you, Rush, and everyone a little bit more of a bird's eye view.
Great. And Ashley, it looks like we've got a hand up with Cyan. let me go ahead.
Yes, Cheyenne, go ahead.
Yeah, my question was related to the email that was sent out with the options. I was just wondering if you could maybe speak more to the first option, which talked about like the 2, 4, 6 weeks, and doing like an elective or like a research elective or a curricular development elective, and what that would mean for scheduling in fourth year, and if people wanted to take the USMLE at the end of third year, like how that would affect everything.
Sure, I can definitely speak to that. So some people, for a variety of reasons, this isn't the best time for them to come back. Either they're dealing with family issues, personal issues, health issues, just want to wait and see what's happening over the next 4 to 6 weeks. In that setting, you have a couple of options. One is people can just take time off from the curriculum. And to take time off, it has to be less than half of the summer term, which is 6 weeks. So those that, let's say, have a 2-week, experience coming up June 29th could request time off from that. Anything that you don't do now, you'll of course have to make up. You need to have those same clinical experiences to get the skills to go out there and be doctors at the end of this. Keep that in mind. It'll be some time away now, but made up later. If you take that time off from the curriculum, it's a simple form that's filled out. As long as you're still enrolled in half of the summer session, things like financial aid and insurance coverage, if you have it through UCLA, would not be affected. For those that want to enroll in experience and get some hours of credit that will be purposed towards your fourth year requirements, there's a chance to sign up for a research elective. And for those of you that have clicked on the link and have seen that it says they have to be submitted 2 weeks in advance, of course that's waived. But we would want to hear from you as soon as possible if you're thinking of doing this, so we can make the scheduling adjustments very quickly and as soon as possible. But you would, secure your principal investigator, make sure that it's a project that you could work on, virtually from wherever you're living at the moment, things like, data analysis and manuscript preparation, et cetera. And as long as you have that supervising PI that would then sign off that you've done the work, then you would get credit for either 3, 4, or 6 weeks of research time. The last option is our curricular development elective. That would be working with me to work on what we see as some opportunities for improvement in the curriculum. That may be writing self-assessment questions, working on new pieces of the curriculum that we're developing, working on video development. That's sort of, very quick to arrange. It's just a phone call and hearing about the options of what can be worked on. And then it's sort of a project that you can work on your own time with some guidance and support. As far as what things look like on the other side, making it up, so things would roll from the beginning of the third year off to the beginning of the fourth year. You would not need to necessarily finish the things that you didn't take now before sitting for your step one. You already know the deadline for step one, but you would need to finish all of the third year clerkships to start your fourth year activities, which would be called your sub-internship, sort of your busiest, most challenging rotations in the fourth year or fourth year electives. So what that might look like if you were studying for boards would be that you finish your third year. There's a 2-week spring break after the third year. Some people will begin their step one prep during that time. Let's say you thought that you needed 4 additional weeks at the beginning of fourth year to study for your step one. You would take those 4 weeks, you would study, you would take the examination, and then the next available starting point for the clerkships that you had deferred at the beginning of this year, you would then go in and finish those off. Let's say that it's 2 2-week clerkships, you would finish those off. That would put you about 8 or 9 weeks into the fourth year. There's about 15, maybe a little bit more weeks that you can use to do really important sub-internships that get you ready for residency applications. So there still would be time to get 2 good sub-Is in and get your application out. But you'd have to stay on track in between to make sure that time interval is there when you need it. But that's sort of an overview of what that picture would look like.
Yeah, that was an outstanding overview from Dr. Napolitano. I just would add another comment just to add to that. I mean, at a high level, the real question is, I guess the philosophy is that, we believe that you're more than ready to start clerkships, and we believe that you can enter into the clinical clerkships and have a great experience. And we're grateful to the clerkship chairs and to leadership at our hospitals and clinics for doing that. We do recognize that there may be instances in which there are very compelling set of circumstances that may cause you to want to. In fact, when the COVID-19 pandemic began, practicing physicians and nurses, some did need to opt out of staying in the clinical environment. So, for example, someone might have a spouse or family member with a significant illness, with significant immunocompromise, and just the even non-zero chance that they might inadvertently themselves bring COVID into the household, did cause some people some pause. I think as we've learned and gotten all better with PPE and precautions and co-location of patients, it's significantly mitigated the risk for even practicing physicians and nurses. And you'll hear, of course, from our guests here in a few moments. But I guess I would just say that 2 things. One, if you're thinking about that, strongly encourage you to sit down with your assistant dean and talk that through, because as you listen to Dr. Napolitano, there are some downstream consequences that you'll want to really think through, and also just to get advice from your assistant dean, from your classmates, from your 4th years, from house staff about trying to reconcile so that you can make the most informed decision you can. We think we really would love it for all of you to enter into clinical rotations and begin that important formative part of your career. But we wanted to create this for folks who in compelling set of circumstances want to have an option.
And Rushan, I see your hand is back up. Did you want to ask another question? Go ahead.
Hi, thank you, Ashley. A classmate just wanted to clarify, for students who are interested in dropping the first clerkship or taking time off from the clerkship with made-up weeks at the beginning of 4th year, would those clerkships be graded credit, no credit, or resume back to 4th year?
It's a good question. It's a question we don't have a full answer to yet, because this, the latest offerings of the research elective and the curricular development came from requests on the student side, and were just sort of approved in the last few days. I would, venture my opinion that they are more likely than not to stay credit, no credit, particularly if they're 2 or 4 week experiences, meaning people that have already had the virtual component and that are coming back to 2 weeks of an in-person component, because there's been a lot of discussion with the clerkship chairs already about the duration of time that someone needs to be on a clerkship to get a valid evaluation, assessment, I should say. So that's my strong opinion, although that hasn't been necessarily run through the committee yet.
Yeah, I think that's probably right, because I think by inference, I'd agree with you, Dr. Napolitano, that the COVID impacted clerkships, that would be the sort of clinical second part of a COVID impacted clerkship. However, for the traditional clerkships, although that there probably aren't too many examples where that might come up, but if it did, what was approved for pass-fail were clerkships for the academic year. So it is possible that you might, if you deferred and had a clerkship that was not COVID impacted, that is not part remote, part live, but just a sort of more normal rotation, then it actually might be graded, at least based on the current policy that was passed by our FEC. So just, again, most important thing to take away from that is if you're thinking about doing that, couldn't encourage you more. Sit down with, get on the phone with your assistant dean and talk it through, just so you're being clear about all the permutations that might be applied in your very specific circumstance related to your specific specialty. Because as Dr. Napolitano said, on the back end, depending on the specialty that you're thinking about, the number of sub-Is or specialty rotations that you'll want to be able to have the option to do will be different, depending on whether it's medicine or surgery or orthopedics or whatever it is. It's a little bit different calculus. So you want to just talk that through with folks who can advise you about making the most informed decision you can.
Just want to add one other quick thought that may be intuitive, but I just want to make sure folks realize that if you do a research elective or a medical education elective, those weeks will count towards your MS4 elective week requirement. So there are 30 weeks of requirements in the fourth year, and those will count towards meeting graduation requirements.
And that's important. Just so if you do that, then it means as you frame shift things, you won't run out of time in the MS4 year. So that's a very important consideration.
Good. So excellent questions. Let's have a last call for any questions about, policies and procedures before we get to the chief residents and MS4s that are here that can answer, specific things that might be on your mind about, walking into the clinical realm. All right, seeing no hands raised, I'll give a really quick introduction, but then I'll let the team sort of introduce themselves a little bit more in depth. But, we're really lucky tonight to be joined by Doctors Monica Zhang, Will Cope, and Evan Shi from the UCLA Medicine program. We have Dr. Maxine Tang from the Olive View program as well. We have Simon Levinson, one of our MS4s that's here to answer questions. And I can't tell whether Sara Anderbrand is on the line. I see one of the participants is Sarah's iPhone. Oh, perfect. I guessed it right. So welcome. I think the panel here has sort of a variety of experience in different settings, including, Reagan, VA, Olive View, Harbor. So I'm really happy to have them here to kind of share their insights. Maybe, Monica and Will, you're at the top of my screen here. We can just start with kind of a maybe one sentence intro from each participant, and just maybe one thing that you would maybe want students to know as they enter the wards.
Hey everyone, I'm Will Cope. I guess I can now officially say former chief resident as of today, actually, at UCLA Ronald Reagan, and very excited to be a hospitalist next year at Reagan as well. I think that just to sort of mirror what a lot of people were saying before, it's absolutely incredible what's been done over Zoom recently, and all of this, the learning that has gone on is just magnificent. But then at the same time, really nothing can quite mimic really being on the wards. And I think while many things have changed, certainly, I think the sort of core of what we do on the medicine rotation hasn't changed fundamentally. It's a lot of little things that have changed, and sort of like how in real life right now, lots of little things have changed, but at its core, I think the medicine rotation, once we're back on the wards, will still run fundamentally like it did before.
Yeah, so I'm Monica. I'm also a now former chief resident of medicine, and I also work primarily at Ronald Reagan in Santa Monica. And next year, or I guess in a week, I'll be starting in the extensivist clinic. So as far as what to know going into clerkship, it's a really exciting time, and leadership has worked really hard to make sure that students are very safe going into the hospital, despite the possible coronavirus exposure. I think overall, there are rules in place for you guys to, avoid, to minimize exposure so that you can focus on learning, other medicine and experiencing the clerkship as normally as possible. And I think the Zoom clerkship, the clerkship chairs really worked hard on the Zoom clerkships, and you actually got a unique opportunity to practice oral presentations and consults even before getting onto wards. So you might actually be better prepared than previous years.
Great comments. Maxine, you're next on the screen here. Could you give a little comment to the group?
Yeah, hi, my name is Maxine. I'm one of the new All of You IM Chief Residents and also a former UCLA medical student. So I just wanted to say that, at All of You, we're always really excited to have medical students. I think it's really the best part of our year when we have you guys starting. And we're very excited to have you guys. From a program standpoint, our number one priority, is the safety of our residents and our students. And so, all of the policies that we've put in place and all the changes that we've made has been with that in mind. So, as you guys know, you're not going to be actually even seeing COVID positive patients. We obviously screen all of our patients before we admit them to the hospital. So yeah, as Will and Monica said, we're hoping that we can provide as kind of normal an experience as possible on your medicine clerkship, and hopefully you'll be able to get as good an experience now as you would have last year. We have plenty of patients with non-COVID problems in the hospital, and so we definitely need everyone involved.
Well stated, Maxine. Evan, let's go to you next.
Sure. Hi, everybody. My name's Evan. I'm one of the new UCLA internal medicine chiefs. I made sure that Will and Monica lost their money on their badge today. We miss them very much, though. We're really excited to welcome you all back to your clinical clerkships. And if you're at UCLA, I'd be happy to personally welcome you. These are formative years of your training. We want to ensure that your safety and your education are our top priority. And our attendings and our residents are really looking forward to having your energy, your curiosity, and your dedication back on our services. I just want to echo what everyone else has said. We've been navigating this COVID pandemic hand in hand with hospital leadership, with program administration. They've taken great measures to, prioritize our safety. We want to make sure that we're doing the same for you all. Things such as universal testing of patients, universal symptom screening of everyone that comes into the hospitals, universal masking, things that our program has done that we want to invite you to do as well. As we've asked if any residents identify as high risk, no questions asked, we'll do what we can to make sure that you feel safe on your clinical services. I, as a resident who recently worked on the cohorted Reagan Ward's team, I think for COVID, I felt very safe. I felt very protected and communicated with. I never felt like I was put in a position that I wasn't comfortable with. So please feel free to reach out to, your school. I was a previous UCLA student as well. I already know how great of a job they do advocating for you. And we just want to continue to support you as you enter this very, it's already a crazy time to be starting your clerkships. This is MS3s. We're coming back even, and just to throw in a global pandemic, our door's always open to help you out with it. So I'll stop there.
Thank you so much, Evan. Sara, I know you've already had experience with a couple of sites, even in the beginning of the fourth year here. I was wondering if you could give a little intro.
Yes. Hi, for those who don't know me, my name is Sara. I am a now risen MS4. I started off this year at Harbor in the respiratory ICU, or just their medical ICU. It was one of the rotations that wasn't canceled, and I was a little confused. It's like, what? I know people in different spaces that are that are getting pulled out, but I also made peace with the fact that if I'm choosing to go in, I recognize the inherent risk, and truthfully, a grocery store feels even more crowded than the spaces that I was in at times. I'd like to echo a lot of what's already been said. Like as a med student, I was on the non-ICU team or the non-COVID ICU team, and there are a number of patients that we can still that are still in the hospital, and we can contribute to their care. And I definitely felt like I had the opportunity to. I'd never felt unsafe. And the attendings and fellows that I worked with were always very cognizant of the fact that I was a student, that, you know, I wasn't supposed to be in certain spaces, and continuously guided me during my time there. They were also surprised to have students back because it had been about 2 months since they had seen a med student. But yeah, ultimately I felt good. I felt good being back in, and I was excited to be back in that space. And I recognize that there is a lot of anxiety around it, but you know, if my word means anything, the people that we are working with are very conscious of all of our angst right now, but also they care for our safety. I did end up getting pulled from Harbor because there was a slight uptick in cases, and I mean, you just have to expect that. Nothing can ever be known, especially in the current iteration of our world. But and I was moved to Cedars, and admittedly, it was an entirely different feel and way of grappling with what is currently happening. There was temperature checks as soon as you walked in. I'm now at Reagan, so 3 hospitals in the last month or so. Reagan and Cedars, definitely, there's temperature checks when you walk in. Everyone is wearing a mask at every hospital, and that's just normal. Rounding will feel a little like you're breathing through this mask the entire time, but it becomes a small thing. You get used to it very quickly. But throughout these 3 hospitals, one thing has remained true. Everyone is conscious. Everyone is really careful. Everyone is working to make sure that med students remain engaged, but also acknowledging that there are limitations to that. There are times that I can't go into a room because there are already 3 patients there, or there are already 3 people there, a patient, a significant other, or a loved one, and then the attending. And so there's small things that we need to concede and that we will concede throughout this year, but I think that ultimately a lot is being done to ensure that we can remain engaged. And I'm more than willing to ask any specific questions had about the topic as well.
Great. Thank you so much for those insights, Sarah. Last but not least, I'm going to throw it over to Simon Levinson, another one of our MS4s who's had experience both at Harbor and Reagan already in the 4th year. Before I open it up to him, I just want to let the audience know that after this, we will open to questions, and anything on your mind, feel free to ask this group and put your hand up. But Simon, some thoughts for the students?
Yeah, sure. Thanks, Dr. Napolitano. So I'm Simon. Hi, everybody. If I have never met you, but good to see you all. I would just say, honestly, I mean, I remember it was nerve-wracking to start 3rd year, right? But honestly, it's so much more fun than the first 2 years. Like you're just doing real stuff during the day. Everyone's really chill. If you go into it and you're just, and you just have a positive attitude, you're in a good mood, and you just kind of just watch, listen, kind of see how the team works. It's not hard, and you're gonna fit right in, and no one is gonna be pressuring you to do things that you don't want to do, and you can end up having a really good time. I honestly really enjoyed pretty much all of my clerkships, and I still keep in touch with some of the residents that I worked with on some of the teams. So it's a really good time. So I wish you all the best, and I hope that you guys have a really good year like I did. The thing I would say about the COVID stuff, similar to Sarah, I was at Harbor. I started at Harbor, and there was a little uptick in COVID cases. I was in the surgical ICU. And I would say the same that a few people have said, like Dr. Napolitano, Dr. Miller, all of them, all of the deans and really have our backs. And I had to get pulled out of Harbor, and within 10 minutes, kind of shooting Dr. Napolitano an email about it. I hit my phone would ring, and he was hey, it's Jason. And I was hey, Dr. Napolitano. he switched me over and I started on a new clerkship at Reagan and he just said, like, don't worry about it. I'll figure out all the rest. And as far as I know, it's all been good. And I got to work with Dr. Middlecoff. So it was super fun. I think like, stuff is going to happen and stuff like that is going to happen as you go, but they'll figure it out for you. And hopefully it's not too stressful and it's not too much like on any one individual to do. And I hope you guys have a really good time.
Okay. Good. Thanks all for the lead off comments there. I don't see any hands up as of yet. So I think while we wait for people to think of anything that they may have concerns about or questions about, just what will the day look like, how early should I get there, what sort of line will I have to wait in when I get to the hospital, any of those things are definitely fair game, and I know that they've been on people's minds. But while we wait on any questions for the students, I'll just open it up to the panel to see if, I'm sure there's other things that come to mind as far as, what you would want a third year student to know as they walk in, Monday morning.
I can talk a little bit about rounds and how they may be similar and in some ways different than in the past. So I think particularly on medicine in the past, the goal was always to walk around on all of the patients with sort of both sides of the team. Of course, this didn't always happen by any means, but that was sort of like the gold standard. And that has certainly changed somewhat in the time of COVID. And for the third year medical students, there was certainly a lot of learning on rounds because of this, because of seeing all the patients, including the patients that were not their own. Now there's a little bit, I think in some ways maybe even better for certain medical students, in that there will be a little bit more emphasis on seeing those patients that have more educational value to them, or specifically have changes in the clinical status for some reason specifically to see, but not all patients will always be seen with the whole team. So I think, making sure as a third year, I think one important thing will be making sure, just because sometimes it can be hard to remember which students have which patients and things like this, making sure that you're taking some ownership over the patients you have, and making sure that you're saying, hey, I'm coming with you to see this patient because that's my patient or whatnot. Just because rounds may be a little bit less standardized at all times. There may be, because of that, a little bit more emphasis on sort of card flipping beforehand. And this is a great opportunity. That card flipping is where you talk about the patients before actually going to the room and seeing them. And this is a great opportunity to still be really engaged in patients that aren't even your patients. For instance, if a medical student along with you, or an intern or a resident is presenting a patient that's not yours, and you're maybe not actually at the patient's room because that's a patient you've decided that for the sake of decreasing the amount of exposures and whatnot, you're not seeing that day. Still being actively engaged and talking about the plan and things like this is really, really important. And then I guess I can just say a little bit about the actual, and please feel free to anyone to correct as well. But in terms of actually dealing with, COVID patients on the wards will be directed to the non-teach, or rather like what we like to call the direct care service at Reagan starting on July 1st. So unless the census goes up dramatically, which of course then there's whole other discussions, but unless the census goes up dramatically, those COVID positive patients will be cohorted on the direct care service and not being taken care of on the house staff services where the medical students will be taken care of. There, however, then is another sort of set of patients where you can think of as these high-risk patients. So patients that haven't actually come back as positive, but maybe they have some clinical factors to them that make you think that maybe they're still high risk for COVID, despite maybe even a test already coming back negative, or you're waiting for the test. these are also patients that I think everyone on the teams will be very keenly aware of not having medical students seeing. But that leaves really still, I know you may not think about it by seeing the news. You may think, oh, it's all COVID patients in the hospital, but honestly, it's still the vast majority of the patients we're taking care of in the hospital don't have COVID and are very quickly ruled out for COVID, or maybe what we call low risk. So we think that they probably don't. We get the test, comes back in a few hours. If they're negative, then we're very comfortable that they don't have COVID. And these are certainly patients that having medical students will be having no trouble seeing, and we'll be encouraging them to see. And that really is the majority of the patients right now.
Thanks, Will. That was very instructive. We have a couple of hands up.
Yeah, first one is Yadira. Go ahead, and I'm going to ask you to unmute. Go ahead.
Hi. Yeah, my question, I think it's for like fourth year residents, in terms of like our first day, if there's some things that you feel like we should do to have like a successful first day of clerkships, whether it's like a checklist or some things that like, I don't know, making sure we know where each office is at, et cetera. What are those things that we should really make sure to do that first day of clerkships?
I can just say that anytime I've always started on a new clerkship, the hardest thing is always just knowing where to go, like physically. And then once you find the people, then you just say like, hey, I'm Simon, I'm a medical student, I'm on your team. And they don't really question it, and they kind of just like, okay, awesome, come on. And so I think as long as you have like a communication about where to go, and like that like first thing, like where you actually go to like find your place, just don't be late. And just go there, and then someone should direct you to like the actual place that you go, or give you a little like tour, walk around. That's pretty much how it's been for all of the clerkships that I've done. And then as far as like anything to do with your first day, I think in general, your first day, you usually don't have like a patient that you're always following. So you just kind of listen in on rounds. You kind of, they'll talk to you. They'll kind of show you how the computer works and stuff like that. And they'll all know that it's your first day of MS3 too. So they'll kind of give you, I'm sure, a little like thing. But I don't think you have to like do anything. It's just kind of like being there.
Yeah, I'd agree with all of that. And I think that, honestly, your first day will always feel awkward. I think we're now, after all of third year and the start of fourth year sub-Is, we're at like 11 or 12 first days now. And every single time I feel lost, honestly. But I do think that something that's helped as I've gone through the year is I've gotten over the fear of feeling like a nuisance. And I think that that's really important, because your first day, it's easy to, because there's so much more leeway, like because you are a new student, they know that you don't really know what's happening, how the workflow really, really works, like how it all goes down. You can ask as many questions as you need, and just don't feel like you're in the way. Don't feel like you're a burden, because it's so much easier when you get it out of the way at the beginning. All of the things that Simon said. Where do I go? What do I do? Which note templates do I use? What is the flow of the day? What do you expect of me every single day? Just ask all of those questions at the beginning. And of course, more will come up, because it's impossible to answer all at once. And truthfully, the team could be busy, so they might not be able to answer all at once. But just get it all out of the way at the beginning as much as you can, and don't feel scared to do so. Don't feel like you'll be an undue or like an unnecessary burden to them. I think that's really important.
Amazing advice. Looks like we have one more hand up.
All right, Miriam, go ahead. Miriam?
Mute myself.
There you are. Hello.
So I wanted to know which sites or rotations can we expect to have the ability to get scrubs from? Thank you.
Dr. Ha.
Oh, go ahead.
Oh no, actually, I don't know if Dr. Ha's there. I can speak to this to say that when you're on surgery, you will have access to the scrub machine at your individual sites. For the other rotations, you'll likely have to bring your own scrubs. And correct me if I'm wrong for Sara and Simon, who have been doing that for a year, but that's my understanding of the scrub flow.
I think it's OB-GYN also, you'll have access to the scrub machines. And honestly, if you have access to some scrub machines during surgery, you'll continue to have access throughout the year. Everyone has access to Reagan scrub machines because of it was given to us during third year. And you can kind of use those scrubs everywhere. A lot of the county hospitals are not particular about their scrubs. From my one rotation at Cedars, they're also not particular. So I definitely wore Harbor scrubs at multiple locations just because I had the most of them. But yeah, it's surgery, pretty much hands down. OB-GYN also hands down because you're going to be in the OR. And then I think some people got it for IM, but I think all of you got it for IM. But that's it.
Yeah, the only time scrubs matter, like what you have, is if you're going to go into the OR. And at Harbor and all of you, I know they also have like paper scrubs that you can like put on for your first day. But no one would expect you to like have that set up on your first day. They'll tell you like our office to go find in the basement to set it up, and it'll be hard to find, but you'll find it.
Great. Tricks of the trade. All right, I'm not seeing any more hands up. We're coming right up on the 7 o'clock hour. I guess before we throw it back to the deans, any of the panelists have anything else that they just really wanted to say but didn't get a chance to say yet? Okay. Well,
I would say one thing. If you need it, I would say like practically, like if you need a mask, they'll give it to you at the front door of all the hospitals that I've been to. And if you need an N95 mask, you can ask your team, but they'll always have them at the nurse's station, and you can always ask for one of those, and they always will give it to you. At least that's been my experience for the last like 6 weeks. So that's just. And if you need a face shield, the nurse's station will also have those, so you can usually find those there if you need it.
With all these mentions of nurses, I think that's one really helpful thing for in terms of where to go during your clerkship, first day, second day, third day. Know the nurses' names, and they will guide you through so much. That's just baseline. Know the people around you, know their names, because you're going to be seeing them every day for 3 to 6, 8 weeks, whatever it might be. So know their names and develop relationships, because they'll help you when you're lost.
Great. Well, thank you so much for the panelists. I know you're all quite busy, and we appreciate you spending an hour here with us. And for all the rising MS3s, you're going to be very lucky to be working with the people that have just been, sharing their insights. So now I'll just I want to make sure that, Drs. Martin and Braddock and Miller and Ha, just make sure there wasn't any last words that you wanted to say as we wrap up.
Have fun. Have fun.
Go ahead, Martin, please.
I want people to have fun. I mean, I listened to all of the, the 2 MS4s, and I just think you guys are going to have a great time, and everybody's going to make sure you're safe and enjoy, learn. And then with that, I'm going to pass it over to Dr. Braddock. I didn't mean to interrupt you.
Ditto. I do want to thank the MS4s and our 2 former chief and current chief resident for joining. Your wisdom is just priceless. I want to thank Dr. Miller, Dr. Napolitano for your leadership in pulling this together, and to the assistant deans and all their staff for their dedication, the clerkship chairs. So again, good luck. This is a wonderful time for you. It's going to be pivotal in your training, and these are days that you, I promise you won't soon forget. So have fun, learn, and enjoy.
I have a quick thing. I just want to, I don't know if Holly's on, but Deb and Ilgi are here, and I just wanted you to give a shout out and a quick hello to the class.
Yeah, sure. I'm happy to see so many join. And I was actually just going to also with my clerkship chair hat on, just thank you so much for being flexible and patient with us as we put your schedules together. And usually we would have your schedules to you by now, and we promised them by tomorrow, but we're just putting things together. And just thank you for your patience. And we're really excited to, we did an OSCE earlier this week, and we sort of pretended to examine a child, but we're really excited to, those of you going to PEDS, to get you back in the clinical setting so you can really see those kids.
Yeah, I'm so glad to see so many wonderful Utilis teams out there, and I will say seeing Simon and Sada warmed my heart because they're in my society, so I was glad to see you guys and sharing your wisdom so generously here with the rising MS3s or the current MS3s. I really hope that all of you know that all of us are here to support you. I know that Dr. Lehman, Napolitano, Middlecoff, everyone, we've been doing a lot of individual meetings to help support each of you if things come up. I'm an email away, a phone call, Zoom meeting. I've gotten really good at Zoom, so please have a low threshold to reach out. If you have questions, if there are things that we can help guide you with, that is what we're here for, and we just want to help you thrive. So stay safe, and maybe I'll see some of you over at All of You.
Dr. Cal, Holly's there.
I am here. Yeah, I just wanted to echo that, and also I was just in the CCU for a couple weeks, worked with Simon, which was so much fun. It is just great being on the wards, and it is so much fun, and you learn so much. I learn something new every time. It's why you've come to medical school, and medical school just gets better and better. Third year is awesome. You guys will have so much fun. I just embrace it, enjoy every minute that you can, learn as much as you can. It is just the best thing, taking care of patients. And again, I just can't, you'll see next week when you get on the wards just how wonderful it is. So enjoy it, learn so much, help so much. You guys add so much to the clerkships. It makes it so much more fun for us with you there. And ask as many questions as you can. There's nothing more than we like to hear is from you and asking questions. It just makes everything so much more interesting and fun for us to interact with you. So don't be shy, be out there, pitch in, help, ask questions, and just have the time of your lives. It's wonderful.
Thanks, Holly. Daphne.
Hi, I just wanted to say it's really great that the fourth years could give their wonderful wisdom to the third years, and thanks to the chief residents who were on the call. It's really going to be a really exciting time for all of you, and I envy you just the experiences that you're going to have this year. So it's just going to be a great year for you, so enjoy.
And I'm going to add that the folks who spoke got me stoked to do a medicine clerkship. I kind of want to be on service with Ed next week. And anyway, thank you all so much for contributing to this. And please know to the class how excited we are for you. And I hope, that you're able to sort of palpate the enthusiasm and our excitement for what you're about to embark on, and have a low threshold. Just ask questions, and you've got to know that every person that you're going to be working with next week on the physician team was in your position on the first day as a third year student. So wishing you all the best.
Perfect. No better words to end on. So we'll call it a night there. Thanks for joining, everyone. We'll see you on the wards.